Thank you, Dr. Wright, and many thanks to our wonderful colleagues at the Office of Disease Prevention and Health Promotion who have set up this webinar. And special thanks, of course, to the many who are on the webinar and listening across the country. I'd like to spend just a couple of minutes giving you a brief overview on this month's leading health indicator topic, mental health. Next slide, please. Being healthy means having your emotional well-being as well as your physical well-being, and so mental health and physical health are inextricably linked. There's much data to show that mental health disorders are associated with the risk and occurrence of many serious chronic diseases and health conditions, and also affect and are affected by the management, progression, and outcome of those conditions as well. For example, we know that children and adolescents with untreated mental health disorders are at a high risk for many unhealthy and unsafe behaviors, including self-directed violence. Also, mental health disorders can lead to substance abuse and predispose to violence and injury. Substance abuse will be a leading health indicator topic for the future. We know that injury from self-directed violence is a leading cause of death and disability. And on this slide, we stress that in 2009, suicide was the 10th leading cause of death in the United States, resulting in nearly 37,000 deaths. So the link between mental health and physical health is very strong, and that's what we're focusing on today. Next slide, please. Let's focus on the two indicators for mental health: suicides and also adolescents who experience major depressive episodes. We know these are critical outcomes. First of all, suicide is a devastating condition that impacts not just individuals, but also their families and their communities. And also, approximately 20% of U.S. children and adolescents are affected by mental health disorders during their lifetime. So these are two very important indicators, and we know that for both of them, we need community interventions to address these challenges. Let's review where we are with respect to these two indicators from a national point of view. Next slide, please. This slide is an overview of the first indicator, suicide, showing that the suicide rate has increased by a little over 10% between 1999 and 2008 and is above our Healthy People 2020 target of 10.2 incidents per 100,000 population. Next slide, please. This slide shows very dramatically a striking disparity between suicide rates among males and females. The rate for males was nearly 4 times that for females, as you can see here. But we should also note that females have a much higher rate of attempted suicide, but males have higher rates of completed suicide, and that's why you see the disparity that's noted here. Next slide, please. This slide depicts the racial ethnic disparities for suicide, and we see disparities for just about every leading health indicator in this series. And from this slide, you can see that whites and American Indians have suicide rates higher than the Healthy People 2020 target, while Asians, Hispanic Americans, and blacks have rates that are lower, in fact, roughly half that of the white and American Indian groups. Next slide. This is a very graphic map that shows suicide rates by geographic region. And if you focus on the areas that are dark brown or extremely dark brown, the highest rates are seen in the Western Mountain region, whereas the lowest rates that are depicted in white are seen just east of that Western Mountain region. So we can have discussions about why we are seeing these trends in the Q&A and beyond. Next slide, please. This slide is an overview of the second leading health indicator for mental health, that is major depressive episodes among adolescents. And as you can see in the top bar, in 2010, some 8% of adolescents, that's kids aged 12 to 17 years, have reported having a major depressive episode in the past 12 months, which is higher than the Healthy People 2020 target of 7.5%. And then as you go down this graph, you see disparities by gender, with the rates for females more than 2.5 times that for males. We see disparities by race, with Asian American adolescents having the lowest proportion of major depressive episodes. And you see disparities by age, because within this age group of 12 to 17, those who are older, that is 16 or 17, have the highest rates of major depressive episodes. Next slide, please. So we have determinants of mental health that are either social factors or economic factors, and obviously these are complex topics. But we know, for example, that there are social factors including interpersonal dimensions, family interactions, community dynamics, as well as race, ethnicity, sex, age, income level, educational level, sexual orientation, and geographic location that all bear on these outcomes. And again, we should stress that substance abuse is a complicating dimension for both social factors and economic factors. We're very pleased that today we have a coalition, the CHADS Coalition, that you'll be hearing from in just a second, that has helped implement a SOS, Signs of Suicide Prevention program, in 100% of schools in one school district in Missouri. Next slide. And from a federal level, we want to stress that mental health and indeed behavioral health in its totality, including substance abuse, is a major priority for this administration and this department. In fact, I have the honor of co-chairing the department's Behavioral Health Coordinating Committee, along with Pam Hyde, the administrator for the Substance Abuse and Mental Health Services Administration, or SAMHSA. We have had special emphasis on suicide prevention as a major public health priority, with contributions not only from the Department of Health and Human Services, but also Veterans Affairs, the Department of Defense, Department of Justice, and other federal departments. With respect to SAMHSA's specific contributions, a prevention lifeline was launched in January 2005, with calls coming in from people in crisis around the country, seeking someone to listen to them. So we are very proud to have that service as part of SAMHSA's and HHS's support services. SAMHSA is also funding some 29 states and 26 tribes to reduce youth suicide through grants authorized through the Garrett Lee Smith Memorial Act. The Center for Behavioral Health Statistics tracks these very important behavioral health outcomes. And then very importantly, we have a national registry of evidence-based programs and practices that is a searchable online registry of over 200 interventions that support mental health, substance abuse prevention, and mental health and substance abuse treatment. Together, these interventions have been implemented in over 300,000 sites across the country, making an impact for public health. So with that, I will turn this over to my colleague, Captain Bellardo.